Well, good morning, everyone. I want to welcome all of you to the Bipartisan Policy Center. I'm Anand Parekh, Chief Medical Advisor here. The title of our event today is Education and Health, Twin Pillars for Thriving Students. So good to see all of you. For those of you who are new to BPC, our mission here is to actively seek to take the best ideas from both political parties to promote health, security, as well as opportunity for all Americans. We drive principled and politically viable policy solutions through the power of analysis, negotiation, and advocacy. Today's event focuses on the bi-directional impact of education and health. It's part of a project BPC is engaged in looking at, quote unquote, health in all policies. The idea that policies outside the health sphere, in fact, have a profound impact on health, and therefore health impact should be a consideration for policymaking in these areas. To this end, it's increasingly understood that education is an important determinant for health outcomes. In addition, it's equally understood that health facilitates learning, and thus the education sector is equally interested in promoting healthy learning environments. Just last week, BPC's Early Childhood Initiative hosted an event focused on physically safe and developmentally appropriate childcare and early learning facilities so that children can thrive. We are pleased this afternoon to have an extraordinary set of speakers to discuss today's topic as part of a panel discussion. To start us off, I'd like to introduce Rochelle Davis. Rochelle is President and CEO of the Healthy Schools Campaign. Rochelle will be providing some framing remarks for all of us. The Healthy Schools Campaign is a co-sponsor of today's event and has played a tremendous role nationally in leading effective on-the-ground programs and influencing policy. Rochelle has long been an advocate and leader for children's health, from environmental health earlier in her career to school health over the last 2 decades. Following her remarks, we'll invite our panelists to the stage for a moderated panel discussion, which will be followed by audience question and answer. As a reminder, this event is being streamed live online, and a recording will be available next week. We also thank viewers on C-SPAN 2 watching today. Welcome to all of you. And so with that, I'd like to ask Rochelle Davis to come to the podium, and Rochelle will take us away. Rochelle?
Well, thank you, Anand, and to the Bipartisan Policy Center for partnering with us, and thanks to all of you for being here, both in person, through the webcast, and on C-SPAN for this really important conversation. At Healthy Schools Campaign, our work is based on the very simple and common sense notion that healthy students are better learners. Since 2002, we have worked in Chicago and across the country to advocate for policies and practices that ensure that all children, no matter their race, ethnicity, or family income, can attend healthy, safe, and supportive schools. Healthy schools can positively impact students' all-around well-being, build a solid foundation for learning, and help address the health and educational disparities impacting our most vulnerable children. This work is more important than ever. Over the past 2 decades, the prevalence of chronic conditions that impact students' ability to be in school and ready to learn, such as asthma, diabetes, and obesity, has doubled from 1 in 8 to 1 in 4 children. And more children suffer from a range of mental health issues like anxiety, depression, substance abuse, and ADHD. 1 in 5 children has a diagnosable mental health problem, and nearly 2/3 of them get little or no help. These conditions disproportionately impact low-income African American, Latino, and immigrant children from disinvested and marginalized communities. These children disproportionately suffer from a lack of access to health care and attend schools with less access to physical activity, higher exposure to environmental toxins in the air and water, and fewer school-based health services. Compounding these challenges, many of the same children also live in areas that are less likely to have space for safe outdoor play, and many students come to schools suffering the impact of food insecurity or trauma. The impact of poor childhood health, compounded by disparities in access to health care and supportive school environments, reverberates throughout a child's life. A student who is malnourished or living with an unmanaged physical or mental health condition will have more problems concentrating in class and miss more school days than a healthy student. Children who are chronically absent as early as preschool, kindergarten, or first grade are much less likely to be reading at grade level by third grade. And students who cannot read at grade level by the end of third grade are 4 times more likely to drop out of high school. Research increasingly supports a link between educational success and long-term health outcomes. In other words, investing in education is essential to supporting a healthy population, and an educated and healthy population is essential to a vibrant and strong America. So let's for a moment imagine what it would look like if every student in this country attended a school that supports student health and school wellness as a foundation for learning. In a healthy school, teachers are given the resources and training to support students' overall well-being and build a safe and supportive school climate. Parents are welcomed into the school community, and their knowledge and leadership are valued. The school gives students access to healthy food, physical activity, and clean air and water. And these are not things we can take for granted. The school actively teaches students to make healthy choices that allow them to thrive, and physical and mental and behavioral health care is available. In a healthy school, students learn through lessons and through example to value their own health. Healthy Schools campaign has worked in Chicago and nationally to make this vision a reality. In Chicago, we have engaged parent leaders, teachers, and principals and helped them advocate at the district level for healthier school food and the return of physical education and recess to the school day. And we have helped schools transform paved-over schoolyards into vibrant green spaces for play and learning. We see many, many amazing initiatives and programs in Chicago and across the country. We applaud the school staff, families, and partners who have made these changes happen. The challenge is making these changes scalable and sustainable. To do that, we need systems-level change, including ensuring that schools, especially those serving students with the greatest needs, have adequate funding, including the resources necessary to support healthy learning. Providing schools with the knowledge and tools to understand the health needs of their students, implement appropriate policies and programs, and build the partnerships they need, and incorporating health and wellness into education metrics and accountability systems so that it is prioritized and funded. Now, fortunately, we are at a moment that offers several opportunities to overcome some long-standing system-level barriers. The nation's new education law, the Every Student Succeed Act, or ESSA, has given states new opportunities to address student health and school wellness. For example, under ESSA, all state school report cards must now include chronic absent rates, which can be a very powerful proxy measure of student health and school wellness. In addition, 36 states have included chronic absent rates as part of their state's educational accountability systems. States and school districts are leveraging these new opportunities. For one example, since I only have a few more minutes, a school district in Tennessee, it was hard to pick which one, okay? A school district in Tennessee is using funding from ESSA to support their school nurses' efforts to track why students are absent. This allows the district to get a more complete picture of the problem and identify ways to address it. And the education sector increasingly has a powerful partner in the health sector, which recognizes that health is driven by more than what happens in a doctor's office. Recently, Trinity Health, which operates in 22 states, announced that it will require all of its hospitals to include chronic absence in their community health needs assessments. Also, this year, the American Academy of Pediatrics released a policy statement highlighting the role that pediatricians can play in addressing chronic absence. With the education and health sectors both integrating chronic absenteeism into their metrics and data systems, we have really created a new opportunity for alignment and partnerships. Another opportunity to address a long-standing barrier that schools have faced is some recent changes in Medicaid. States now have the opportunity to allow school districts to be reimbursed for a much wider range of services provided to Medicaid-enrolled students. We are partnering with Trust for America's Health to lead a 15-state learning collaborative so that schools will be able to access Medicaid dollars to pay for school nurses, counselors, social workers, and other crucial health services. States are beginning to take advantage of this opportunity. It is important to recognize that these are opportunities, not mandates, for states and communities to address student health and school wellness. There is much work still to be done at the federal and state level to support schools and communities to create the conditions that will allow all children to thrive. That is why the leadership of our panelists on these issues and the efforts of all of you who have joined us today are so important. This event provides an important chance for us to explore how to be successful in building healthy and supportive school environments so all children can learn and thrive. Thank you.
Rochelle, thank you for those opening remarks, and I think that sets the stage beautifully for our panel discussion today. I do want to take the first maybe couple of minutes and just provide a brief biography sketch of our three panelists. I think most of you know them as public servants, but just so you understand their perspective. To my left, Senator Bill Frist is a heart and lung transplant surgeon and former U.S. Senate Majority Leader, as you know. Senator Frist represented Tennessee in the U.S. Senate for 12 years and was elected Majority Leader in 2003. His service on the Senate Help Committee, responsible for all federal education policy, later inspired him to found SCORE, State Collaborative on Education, to propel Tennessee to prominence as a K-12 education reform state. He is currently chairman of Tennessee SCORE, which he founded in 2009, and he's also currently a BPC Senior Fellow and has led many of our health initiatives here over the last decade. Senator, thank you for being here.
Thank you.
John King Jr. is the president and CEO of the Education Trust, a national nonprofit organization that seeks to identify and close opportunity and achievement gaps from preschool through college. Secretary King served in President Barack Obama's cabinet as the 10th U.S. Secretary of Education. He joined the department following his tenure as the first African-American and Puerto Rican to serve as New York State's Education Commissioner. He began his career in education as a high school social studies teacher in Puerto Rico and Boston, Massachusetts, and as a middle school principal. Secretary, thank you so much for being here. And Secretary Pedro Rivera was appointed as the Pennsylvania Secretary of Education by Governor Tom Wolf in 2015. Currently, Secretary Rivera also serves as the president of the Board of Directors for the Council of Chief State School Officers, a nonpartisan organization of public officials who head state departments of elementary and secondary education. Prior to his appointment to Governor Wolf's cabinet, he served as superintendent of the School District of Lancaster. Additionally, he was a classroom teacher, assistant principal, and executive director for the School District of Philadelphia, as well as a staff member with the Philadelphia Federation of Teachers. Thank you again for all three of you being here, and I think you heard from Rochelle, her perspective, how important this bi-directional impact is between health and education, and I thought it might be helpful to start, based on your experiences, just to share why is this so important and where are you seeing signs of progress across the country? Senator?
Anon, thank you. And Rochelle, thank you for your remarks. It really set the stage beautifully. 12 years ago, I was in the United States Senate, and after being here for a period of 12 years and having the opportunity to be involved in No Child Left Behind on the Health Committee, when I came back to Tennessee, I knew a couple of things. This is being a doctor, or wear the doctor hat first, that if somebody has a college degree, or 4 years of continuing education after secondary school, that they will live 5.3 years longer than somebody who doesn't graduate from high school. I knew at the time that if somebody spent 4 additional years of any kind of education after a secondary school education, that they would have less heart disease, that they'd have less diabetes, that they would live longer, the 5 years coming after that, and that they would have less heart disease, less diabetes, less obesity. What we didn't know then quite as much, but which we've developed the science behind and that gathered the evidence, that when you look at health and health care and how long somebody lives, or infant mortality, or burden of disease, whatever it is, that it's not the doctor in me or the doctor in you that determines how, whatever that measure is, outcome of health, but twice or 3 times more important than the doctor or the type of insurance or the hospital are these social determinants. And what we've learned is that education is a primary social determinant for health. So we have health care over here and we have education here, and what we're talking about today is that nexus of the two, that it's not just correlations, but there's causality involved. And that's how I initially got involved, and we've stayed on it ever since.
That's great. Secretary?
Sure. Well, maybe take it to the simplest level of the student. When I was a middle school principal, I recall we had a student who had asthma, chronic asthma, and he would miss a lot of school as a result of the asthma. But our school was in a building that was shared with a nursing home, and when we got a nebulizer set up for him in the nursing home that he could access, he went from missing a lot of school to being in school regularly. His grades went up. He was a happier student. His family was happier. Right? Just having access to quality health care made the difference for his educational outcomes. So the thing I'm encouraged by is I do think there's a growing awareness among states and school districts that as educators, we have to be thoughtful about how we better connect kids and families to quality health care services. 3 quick examples. There's a partnership between Children's Defense Fund and the Superintendent's Association to use the school enrollment process as an opportunity to talk with families about their enrollment in healthcare, whether that's Medicaid or CHIP or one of the healthcare options on the exchanges or personal health insurance, but making sure that families are attentive to their kids having access to healthcare. That's 1. 2, we see, and we heard about this in the discussion of ESSA, we see states paying attention to chronic absenteeism. What's encouraging about that is not just that they're noticing that data point, but that they're using that data point to translate into action, whether that's connecting families with healthcare providers, or addressing homelessness or housing insecurity, or addressing food insecurity that a family might be experiencing, or helping a family strategize around transportation, or whatever issues are getting in the way of kids missing school. A third example is around food. One of the key things that we know has made a positive difference in kids' lives all over the country is the free and reduced price lunch program. There are many kids where that is their best meal of the day. Many schools have now expanded to universal breakfast programs. That is an important step. Many schools and communities are working hard to make sure kids access food in the summer. We know that something less than 20% of the kids who access the free and reduced price lunch meals during the school year access meals during the summer. But we can do better. There are some communities that have started doing food trucks in the community so that kids have easy access to food during the summer. There's also a pilot project at the Department of Agriculture putting additional dollars on the electronic benefits card so that families can access meals over the summer. And we know that program is working well and increasing the likelihood that kids have access to quality meals. So there's a lot of evidence, I think, that people are paying more attention. We need to get some of the policy barriers out of their way, and also, as Rochelle talked about, work to scale some of these solutions.
Great.
Yes, I think piggybacking off of what my colleague shared, Rochelle did a great job in kicking off, as well as the senator, with identifying and really recognizing the social determinants of health. And I like to share in government, especially now in state government, I've learned we don't always engage in the best ways around pushing initiatives through. But one of the things government does do really well is setting conditions. Setting conditions for success, sometimes setting conditions for lack of success. But at the end of the day, we do set conditions by which communities, neighbors, and institutions live by. And over the course of my career, I've been really fortunate that I was able to return and teach in the community in which I grew up. And I understood that if I really wanted to help others break the cycle of poverty, education was the key. Really being steadfast and focusing on improving the quality of education of students in my class, building, system, and beyond. But what I quickly learned is that we couldn't focus on the traditional ABCs of learning without really realizing those social determinants of health. But realizing that there are students in our communities that live with food insecurity every day, deal with issues of homelessness, have physical health needs, mental health needs. And quite frankly, many of those in some of our most vulnerable communities lack access to quality supports around those needs. So as a teacher at a real small scale, something as simple as providing laundry cards or providing meals in my classroom or providing tokens for public transportation, I was able to better support the 100+ students in front of me each and every day, and I had started to really become committed in focusing in those areas. So as a school administrator, and then ultimately as a district administrator, and now as secretary, continue to look at opportunities to expand that reach, but more importantly, solicit other partners that can help better serve our students. As a teacher, may have just been the corner store owner, but now as secretary, I'm fortunate that it can be the Secretary of the Department of Human Services or Secretary of Agriculture at the state level, Secretary of the Department of Corrections or Labor and Industry. So what we've been trying to do, and I know we'll get a little deeper around this, but understanding that if we have the responsibility and the opportunity to set conditions for practitioners in the field every day, by working together to ensure we have a really direct, rich narrative around why we exist, how we should be best serving our communities, focusing our collective impact in terms of mission, to better serve those most vulnerable communities, and being unapologetic around the need to focus on equity. And just for the sake of the rest of our conversation today, what we've done in the Commonwealth of Pennsylvania with support of our governor, we've said, we've defined equity by saying it's making the resources, opportunities, and supports available to communities when they need them, how they need them. Not how we feel like giving it to them or when we feel like giving it to them, but making those resources that they need to be successful in the manner by which they need them. And that goes, from everything from educational opportunities to, health and human services impact.
Great. So education is a powerful determinant of health. Health impacts learning. Areas such as physical activity, nutrition, critical, safety, environmental conditions in schools, critical school-based clinics. There's a lot of good literature there. It improves GPA as well as improves health outcomes. So it sounds like we know that this is pretty important. Maybe Secretary King, we get right to your point about barriers. So we might see sort of pockets of success here and there, but what are the biggest barriers, whether you're a state or a school district or a health provider or a health insurer, in terms of collaborating, bringing education and health together? Are the barriers funding? Is it accountability? Is it data? Is it culture? Can you go through maybe what are the most important barriers as to why these two sectors, given that we know that it's important, we know that bi-directional impact.
I'll start right off because I'll probably be reflecting, or we'll take the stand of reflecting the health part of the health and education part, because I think you just saw we can get programs in there, but how do you take them to scale?
Yeah.
And scale is going to be an alignment around common goals. And again, I'll let my colleagues talk about the pure education, but on the health part of it, we have two problems. On the funding side, at the state level, and most of the education is not federal policy, but at the state level, State budgets are set, it's really sort of security and safety, and it's health, Medicaid, and it's education. You have to balance your budget, so if you put more money in education, health comes down. Put more money in health, education comes down. We have 75 or since 1960s to show that. What we need to do, and I'll again speak from the health perspective because it's a parallel to what healthcare used to be 10 years ago, really before President Obama began to really put together value-based healthcare spending. Not just fee-for-service, not just more MRIs you do, the more you get paid, or the more primary care visits, or the more heart surgery I did, I get paid. But to reimburse for not just health care, which that is, fee-for-service, but more health and well-being, the sort of words that sort of in the introduction we use. The outcome for both is well-being, is fulfillment, is productivity. And in healthcare, what's happening, instead of a fee-for-service system, we're moving, again with leadership of the past administration and being supported by the current administration, is value-based care. If you look at value and for the care and outcomes and its well-being, then immediately you go not to the fee-for-service, but you go to reimbursing for things, and we'll probably talk a little bit about Medicaid, and again, it was introduced earlier, and that sort of funding. If you want better health, well-being, not just health care, you go to value, and a major determinant, as I opened with statistically, is the education itself. So right now, for the first time, Medicare is beginning to reimburse for social determinants, and food, which again, we're talking mainly food and getting people moving in schools, and then the school nurses coming in from the delivery system. All of a sudden, we're beginning to reimburse here in Washington, D.C. in Medicare, that's not Medicaid, things like food and transportation and even housing. That needs to come down to the Medicaid level, and they're going to be looking for science. And again, it's the common goal, the common alignment about well-being of health that'll drive it. One last thing, at the state level, the budgeting is siloed, and the budgeting is education, and you're focused on education, you're fighting for every dollar, and you got to balance the budget, and it is health. And not until we bring those committees together at the state level and at the federal level around these common goals, and just jumping to the very end, at the end way you do that is at the local community level, and we'll come to that eventually, I believe.
That's great. Senator. Secretary.
Agree with everything the senator said. A couple things I would add. I think we have a political will challenge, an administrative will challenge, and a culture challenge. The political will challenge, I'll give you one example. The states that have done Medicaid expansion see better health outcomes for their children. Now, the politics around that are complicated, and the senator knows more about that than probably anyone else in the room. But at the end of the day, we know that increasing Medicaid participation will lead to better health outcomes for kids and families. One of the interesting data points we see from Medicaid expansion is that actually, even if the kids would otherwise be eligible through CHIP or other programs, they are more likely to participate if their parents are able to access Medicaid through Medicaid expansion. If you're going to the doctor and taking care of your health care, you're more likely to make sure your kid is getting regular access to health care. So that's a political will problem. The administrative will problem is we put out a joint sort of toolkit between the Education Department and Health and Human Services during the Obama administration to help school districts think about school-based health service, and particularly trying to figure out how to leverage Medicaid dollars to support school-based health services in schools that are serving large numbers of low-income students. It's a hassle. It's a bureaucratic hassle. In many states, the rules are quite complicated, and the result is that people don't follow through in creating those school-based health opportunities. It's a lost opportunity for kids and families. We just know people are more likely to access health care if it's immediately available to them at the school site. The culture problem, I'll give you one example that troubles me a lot. So Johns Hopkins did this study in Baltimore. Fascinating study. They looked at kids and reading outcomes, and they found, shockingly, that if you can't see the board or read the book, you do worse in school. I know it's a shocking finding. Similarly shocking, if you provide appropriate vision services, you can see the board and read the book, wait for it, you actually do better in school, right? So, I make light of the study. It's an important study, but what's frustrating is the result wasn't that every school started making sure that every kid had vision screening and had access to appropriate vision care. There are kids who are being held back, right? They're being told that they're not good at reading, they can't read because of something that's so simple, just untreated vision care. So that's a culture problem. We've got to get much better at understanding the intersection between health and education.
You know, speaking from the state perspective and really taking into context what John shared, I think what I've noticed over the past few years and observing some of the systemic barriers that exist in local government right now is far too often we've used policy to influence practice as opposed to using practice to really inform good policy. And over the course of the past few years, we've engaged thousands of stakeholders, from everything from ESSA to our school improvement focus and opportunities. And what we've realized that in many instances, there could be minor tweaks to language that would allow a classroom practitioner, a building practitioner, a district leader to utilize resources or time or even relationships differently, to build in healthcare into a school system or into the traditional block of time. Looking at dental care and looking at hearing and other types of support services. But what has happened over the course of some rigid policy language being created, it's been interpreted in ways where folks just thought they could not focus in areas and on areas that would better serve students and communities holistically. And so whereas we've been trying to really influence and create and draft new policy that takes into account the holistic needs of students, but it takes as much, if not more, energy to reprogram or deprogram some of the old misnomers, what had always been assumed around the language of law or the language of policy or the responsibility of a system, to allow them to think of the kid, the community, the client first. And that was probably one of the areas that has been most surprising to me. As we think specifically around Medicare and Medicaid and other federal dollars being utilized for health and physical and mental health support, the biggest barrier that exists between agencies has been they told us we couldn't do it that way. And so then you ask, well, who's they? And it's funny, no one knows who they is. It's like, they, I'm just waiting for the time I meet someone, he's like, I'm they. And so I said, all right, it's all your fault. And the other is, this misrepresentation of law and language of law and policy. It's interesting, I've now defaulted to always asking first, before moving any further, show me. And then us sitting down and looking at the language of law and policy and then asking, why do we interpret it this way? And can we think differently around the system to better, support the communities and fulfill our mission? I will share with you one of the things that we've been able to do in Pennsylvania. I meet monthly with my colleagues in the Office of Human Services and the Office of Labor and Industry, Secretary of Agriculture and the Secretary of the Department of Corrections. And we take an hour. Less than half of that time is to discuss breaking some of the systemic barriers that exist between, either relationally or in practice between our agencies. But we spend as much time discussing around opportunities moving forward. And as a result, thinking about nuanced changes within language that would allow for better mental health service providers in schools. We're working with the Department of Human Services now to create a reporting system. So if a student goes into a homeless shelter, we can then access that information to connect them to the other services needed, whether it's food security, whether it's access to quality health and mental health services, whether it's something as simple as clothing. With working with the Department of Ag, we utilize state dollars to build infrastructure, to build, to allow funding for systems that keep them from better, accessing federal, Department of Agriculture dollars. So something like kiosks for grab and go programs for breakfast. And so, schools weren't able to utilize that federal funding because they didn't have the tools to utilize that type of feeding. So why not invest a few $1 million to build that infrastructure within a school. Department of Corrections, we work with them to build parent resource centers in their women prisons. So when when a family comes in to visit a mother that happens to be incarcerated, they have the same access to information around services, social services, educational services that you would if you were to visit your school for enrollment. And so by working together, you can better focus on what our communities need, as opposed to trying to meet the mandates that's, quite frankly, often under assumed law or policy language.
I'll just add another barrier, not to the why, because hopefully we'll get to some of the solutions. But right now, the Robert Wood Johnson Foundation reports regularly that only 25% of students in the country have access to a school nurse. Access, not in the schools themselves. And as we've seen, as society has gotten more complex, as we've seen changes like more diabetes, more metabolic disorders, we've seen an 85% increase in the reported chronic disease and disability area that's in schools today. And it's just asking too much for teachers and principals when an absolute quarter of the population has a chronic disease. And we've mentioned asthma, allergy, diabetes, the whole range of diseases or disability. Not to have access to a trained health personnel of some sort. And so within the structure of the school, and there's good news because we can all say that there's progress made. Tennessee has been part of the Coordinated Health Schools program since the last 15 years. And we're the only state in the country that every school district has implemented that particular program. And with that, we've seen a dramatic increase over time, number one, in our schools themselves having access to health personnel. Dramatic, as well as increase in activity. That's if we put food and we put activity and moving, dramatically changed that over time. Still a long way to go, but the neat thing about that, when you look at outcome measures, whether it is the increase in activity or it is in education in terms of performance on math tests and science tests or in cognitive reasoning or attendance or showing up for school, to be able to access those health personnel when you need them instead of having to leave school or take the time of a principal today. That's a structural impediment today that, again, looks more at it from the health angle. And instead of dumping it on a school, we have to merge those two together now that we do have the science. If we share the science, we share the culture, we continue to invest in education and health, that'll come back and help with one of the three, anyway, the culture end of the challenges that we have.
That's great. If we could focus, so I think the specific barriers we talked about, the opportunities we already started talking about. ESSA sounds like it provides an opportunity. I think part of ESSA funds can be used to support perhaps school nurses. There's this focus on chronic absences, which is a critical proxy for health, as Rochelle mentioned. Medicaid's another opportunity. Do you all think the most important opportunities to bring these sectors together, are they at the local level, the state level, or the federal level? Is it really the public sector that's got to lead? Is it the private sector? Probably all the above. But talk about some of the most important opportunities today to get to where you all are articulating where we need to go from a policy perspective. Where do we need to take the lead and to scale and replicate? Senator Frist, you talked about there are pockets of great examples. How do you scale and replicate? Anyone can start, but what are the most important policy opportunities?
I think, in my opinion, having experienced, my role as secretary and how I was fortunate enough to land here, I think we have to start locally. I mean, we have to engage local stakeholders, because at the end of the day, the policies that we inform, are usually implemented to improve the quality of life for local communities. And I think especially now that communities are coming so much better informed and engaged, they really hate when we do things to them. Even if it's a perceived positive intent, if we're doing this for all the right reasons, if we don't involve them in the process, there's going to be pushback. And I do think as we've been able to inform as much policy as we have in the Commonwealth of PA, Those where we've been most successful is when we've engaged the local community. It's when we've then articulated their needs, their thoughts through their lens to our policymakers that we start to see the most traction. I will also tell you at the state level, I think one of the other challenges that we have that our federal counterparts don't have is we have an expiration date. So when you're in state government, if I get to do this for 2 terms, I'm extremely lucky. Most secretaries of education don't get to do this for 2 terms. And so we have to maximize the opportunity that we have in front of us in serving our constituencies as quickly and aggressively as possible. And I will share that I think that the importance of the relationship between public sector and private sectors is especially important. Because what we don't always have in the public sector, but we can absolutely use is the space to be nimble and to create a sandbox to try and to create policy and initiatives that may be forward thinking. And we're under a microscope. If I spend $1 on a failed project, there are 40 people with pitchforks and torches that want to drive me out of State House. So I think where the partnership between public and private is extremely important. Is that through our private sector partners, we have more robust think tanks. We can look to better articulate our plans moving forward, but create the opportunity to experiment. And use what we learn through that experimentation, and those resources to better inform the practice.
Yeah, I guess I'd build on Pedro's point to say I think there's a tremendous leadership opportunity here for governors and legislatures because health and education are the 2 dominant things on which they spend money, and they have the opportunity to realize the financial benefit of smart long-term investments. So, for example, we know that having a nurse visit new parents early on improves long-term educational outcomes and health outcomes. Now, it's a pretty long lead time that you need to realize those benefits, but for a governor and a legislature thinking about, for a state like Tennessee, what's best for Tennessee, not this year, not even this term, but for the next 20 years, for the next 30 years, then you start to say, yeah, we should make sure certainly every low-income family gets those nurse visitation opportunities. Similarly, you might say, well, we've got less than 20% of kids taking advantage of free and reduced price lunch in the summer. What could we do as a state to radically increase that number so that kids are healthier, because that's going to lead to better health outcomes, better educational outcomes for the long term. So I'd love to see more kind of governors and legislatures stepping up to take leadership on these issues. But look, we as the public have to help them by rewarding long-term thinking and not focusing all of our elected officials' attention on just what happens tomorrow.
Again, I will build, and at the federal level, I loved it. I loved the Health Committee. I loved the United States Senate. I loved being Majority Leader, and it was great. But I think we've covered sort of the No Child Left Behind, expectations raised, gaps addressed, but no direct mention of health. A natural evolution with under your leadership under the Obama administration was ESSA, where you had this door open. It has to be reflected even further, and it comes back to really your culture statement, because culture is built at the local level. It has to be, instead of $400 billion in Medicaid, only about $3.5 or $4 billion is in health. 4 out of 400, yet the data is dramatic in terms of jobs, productivity, fulfillment, contribution to GDP over time. So we have to have the federal level. The state level is where most of the education activity, but every governor is an education governor. I mean, let's face it, I've known lots of governors, and they all have education, one of the two. So that's good, and it has to start at the top. We need a president who put it out front, and a first lady like Michelle Obama, who talked about Let's Move and talked about Garden. That is really important, but it doesn't only go so far, because it does matter what, again, the culture. What is that culture of health? And at RWJ, we put a huge amount of emphasis on it. Everybody says, what is it really? But it's really pretty simple. It's aligning this sort of intersection where we know outcomes and value depends on education and basic access to services themselves. And so ultimately it comes down to the local level, because that's where you build political support. That's who elects the congressperson and who elects the governor, because they're all going to run on, and then demanding the accountability, demanding the execution. When we started SCORE, the State Collaborative on Reform of Education, 10 years ago, and Tennessee was at the bottom, and now we're sort of halfway where we need to be in K through 12 education. But the one thing I learned, and the only thing I've learned, and I sort of had the idea to start it and stepped out of the way, but the reason we have been successful is changing the culture at the local level, and then implementation of the policies and execution of the policies themselves. And you do that by only building a grassroots movement of alignment around incentives. This is what will happen if you do. That is why you have to think longer than just beyond the next election, and you have to think long term. The thing is, it does work. The newness of it is taking healthcare over here, which is $3 trillion, 18% of our economy, unlimited money, to education over here, where we're not, whether it's compensation for materials or compensation for teachers and leadership, we're expecting so much. But by marrying these two together with a clear-cut alignment of the sort of data and statistics are there, then we can start building the support. Then we can get appropriate access to health care. We can look at things like telemedicine, which today the technology is there. You don't necessarily have to have a nurse in every particular school. So you start thinking creatively and out of the box, where you can take these good programs out there and go to scale, but you've got to be able to change that culture. But now we have the evidence and the data to do that. I don't even mean to advertise, but a year and a half ago, SCORE brought together 500 people, and that's why C-SPAN is important to us today in the media, and we did a better health, better learning. And we did it SCORE, State Collaborative on Reform of Education, a statewide grassroots organization that works with ideas and leadership, political advocacy. And the other partner with that was a group called Nashville Health, which is a totally independent group, but it's looking at the well-being of a community, of Nashville, of what health and well-being is all about. Which means, as Rochelle said, you take a hospital, and for the first time in the last 6 or 7 years, they're looking at assessments of their community as part of their nonprofit status. They have to do it because of policy. But the good thing about it, when they go into the community, a hospital, and they look at what is actually working there, they say, oh, yes, it makes sense. Our hospital should get involved in our community. Our hospital should adopt schools. Our hospital should go to Blue Cross Blue Shield and do a program like they have in Tennessee, where they put money into education. This program called Go Noodle, which looks not at the food, but looks at the activity in 100 million minutes because of that grant of physical activity that teachers use in 3 to 5 minute videos. All of a sudden, that's where the intersection goes if you hit right at the heart of the culture.
That's great, great. So there's a lot of momentum, leadership in the private sector, Healthy Schools Campaign, SCORE. I want to ask all of you to put your public sector hat back on, former or current.
I've been trying to run from that Senate job.
How difficult is it to really promote these cross-sectoral partnerships? Secretary King, you talked about when you were Education Secretary with Health and Human Services, you all were able to do something in school-based health services. Secretary Rivera, you talked about having monthly meetings with many of your counterparts. I'm curious whether these examples are more sort of norm or exception. And Senator Frist, there is a help committee, sure, but how difficult is it to get folks who are interested in health, folks interested in education, actually help them understand how their policies impact the other sector? What's some advice you all have for your current and former colleagues, either on the Hill or cabinet secretaries at the federal level, cabinet secretaries at the state level, how they come together and work to elevate both of these sectors, connect them? And then, this is for extra credit, another question, how do you deal with things like, Secretary King, you talked about the National Breakfast Program, the lunch program, 30 million kids on the school lunch program, 12 million in the school breakfast program. The jurisdiction over those programs are USDA. That's Department of Agriculture. So sometimes you're dealing with departments that go well beyond just health and education. So talk to us a little bit about, or what's the advice you have to ensure and promote cross-sectoral, departmental partnerships to really integrate these two spheres?
I think trust and collaborative habits are a big challenge. And sometimes you can get folks organized around one particular initiative, and then they move on to something else. So you've got to have kind of a regular partnership, often driven by a set of common goals. So if you say, we're going to collectively try to make sure that across agriculture and education and health that more students are participating in the summer lunch program, here are our metrics, here's our starting point, here's how we're going to make progress. And I think you need to do that not only at the federal level and the state level, but at the local level, right? Getting the local superintendent at the table with the person who runs the local hospital, with the person who runs the local university, with the folks who run local community-based organizations and faith-based organizations, and say, look, collectively, we know chronic absenteeism is at 20%. We want to reduce that by 20% a year over the next 5 years. How are we going to do that? And then start to commit to ongoing collaboration and trust building. Now, there are things policymakers can do to make that easier. We can make data sharing easier. That is often a big obstacle. We can improve the training of professionals. I think if you looked at most superintendent or principal training programs, you would not find a lot of discussion of healthcare, social determinants of health, the intersection between health and education, issues like adverse childhood experiences and the impact that has on young people's long-term health. So we can do training better, we can do data sharing better, and then we can break down some of the silos. Senator Frist referenced this. There are these very stark silos around budgets, and people feel like, well, those are my dollars. I'm happy to collaborate with you, but don't come for any of my money, right? There are committee oversight silos within legislatures. So we have work to do to sort of break down some of those silos so that people have a sense of shared responsibility.
Yeah, I think, first and foremost, it is recognizing the fact that when collaborating and being transparent and trying to be clear in terms of what you're hoping to accomplish, there's a great deal of vulnerability. And that's the role we live in as public servants. I often equate this job, being secretary is like being a superintendent in the middle of a snowstorm and having to decide whether or not to close schools or not. And anybody who's a parent knows how much you hate your superintendent when they choose to close schools or not close schools. So often we have to make a decision around big decisions. But, I think if there is any advice, the advice is we have to be explicit around what need we're looking to address and what goal we're hoping to accomplish. Just to pick one specific instance, when we were looking at summer feeding, one of the obstacles we faced was the need for it to be congregate feeding in some of our rural communities. So our most rural communities, as the language was interpreted, we needed to bring the population of students together in order to use some of the federal funding to provide the summer feeding option. And so we had to bring partners together from both the community but across agencies to find a way to get to provide summer feeding opportunities in some of our most vulnerable dispersed communities. And so everything from we've had communities create what are the equivalents of a school lunch truck, for example. And so they've outfitted, full modes of transportation to serve as a congregate feeding location. We've utilized libraries to provide those services. We worked with our church partners to provide those services. And, by not bringing everyone together, we would have never been able to tackle that issue. Now, when interpreting the need, when interpreting the fix, and really reviewing language, some of many of the conversations were extremely, passionate and everyone had an opinion and everyone, understood their role in this to be sometimes as rigid as it could possibly be. But, by not coming together and addressing, the vulnerabilities, but staying focused on working through those, we would have never found ways to serve students in some of our most vulnerable communities.
I think it's at every level, the federal, the state, and the local level. And what we need, and it comes back to leadership of having people at the very top, whether it's governor, president of the United States, or first ladies, basically say this is a priority. It's always been a priority, but now we have the data to show why it is such an important priority. If you look at sort of the various buckets there, the food issue we talked a little bit about, but the breakfast programs have clearly showed that people do better on tests, better cognitive learning. They show up for school on time, and when you see the data and you put it out to whether it's a federal official at the health committee, it is just clear cut overall. And there are other things. There are processed foods that are at lunches today, which are killing our kids. We, at the federal level, are subsidizing sugar and sugary beverages and vending machines. And again, those are battles that have to be fought, but food ultimately is what goes into our body that gives us health and well-being. On the moving bucket, it's hard because government at the policy level can really create problems. And not intentionally, but just the idea that we're 30th in the world in education, therefore you need more science and you need more math and you need more basic reading skills, all of which is really important. And I was a part of that, No Child Left Behind, and look at the gaps and the disparities and point them out for the first time. But then if that gets translated down to the individual teacher, that I'm going to solely be judged on the scores and expectations are defined just in terms of scores, that means I'm going to sacrifice recess. When I have to punish or discipline a student, I'm going to take away what they love. And it's exactly counterproductive if we're aligned around health and well-being and productivity and productive citizens and a good job. So the moving aspect of it, and I used an example of getting people moving, not just at recess. And there are programs out there which will continue to encourage that, but when we set up reward systems, we don't want to be punishing the movement activity. And ESSA took that to the next level, said, oh gosh, we got to be careful with that. And that's all at the federal level. And I just had a third category, getting kids out in nature. It's getting increasingly hard to do, but with the iPads and the iPhones and the electronics today, using nature, and that means loosening up some regulations where you can go on field trips or you can bring, nature to the schools themselves and learn, life cycles and the natural laws out there and turn people onto science. But you put that together. In the last bucket, again, from a policy standpoint, I'll put the healthcare hat on, because one thing I would like to leave people with is that education is just not funded well in this country. Throwing money at just education without the greater construct doesn't work. But now the greater construct we have the data for, and we just need to execute on it and then implement on that. But there are, as I said, 18% of our economy is in healthcare today. And now that we're making the statement, like through community assessments, where it's very clear that a hospital looks in their community and sees what's dragging people down overall in terms of health is basic access to education and the movement aspect and the food aspect. And so for me, getting that health care involved in the community, as they increasingly are, is a very positive way where both of you who spend all your times in education can at least look to that as assistance over time. Getting the culture right, number one, making the federal and the state policy good to get the barriers out of the way. But ultimately, it's going to take this momentum from down below to actually change the direction so that execution can actually happen.
Great. Terrific. Thank you. Well, I want to offer you all an opportunity to make some final comments, but let's move on to the audience Q&A. I'm sure there are going to be some questions in the audience, and we have roaming microphones, I think, on both sides, so please just raise your hand and please introduce yourself as well, please.
Yes, thank you very much. Is this working? Yeah, okay,
Yes.
Thank you very much for the talk. I realized, of course, I was an international economist and an educator as well. So I can see a lot of things here on what you're saying as being very important. But I realized that you haven't mentioned a very important stakeholder in this whole system. And it's not just the people at the local level and the state level, but what about big pharma? And actually, Dr. Frist, you can talk about this better than I can. But for example, what I'm thinking of as far as the education and the healthcare are children who have dyslexia. They are in these schools and they are in the normal classroom. And they have a lot of problems. And the problems are not just in the schools, but also at home with the parents who don't know how to treat them. One of the big problems, of course, is through Big Pharma that does not provide for anything that really helps those students without making them as, gaga in the classroom. And of course, our teachers are not prepared to deal with the brightness of those students who need to have a different kind of educational system. Can you talk a little bit about how maybe Big Pharma can be involved in this type of thing? And not only with the proper education, the proper medication, but also can they make these medications less expensive?
Yeah, I think first of all, I love your question. But I'm not going to be able to answer it. So, I'll turn to my colleagues. I think, though, you bring up the point that there are huge stakeholders, and you brought up one that I did mention or others, that are outside of the normal purview of the true experts, people who are in education. And now is the time to open up our sphere to reach out and educate them and maybe put political pressure and expose them in certain ways. I mentioned sugary beverages. I mentioned sugar. Again, that's the kind of thinking that I have no idea exactly how to get pharma involved, but I think it's a wonderful idea. I do think we need people in the schools or by telemedicine accessible to people. So it's not the teachers that burden falls upon and the principals it falls upon. And that's something when you talk about telemedicine and virtual health and hospitals reaching out and doctors reaching out and pharma, all should be a part of that equation. Again, pharma is such a big issue. I'm just not an expert in it. And if you guys have anything to comment on that.
I'd just say quickly on the dyslexia point, I think we do have a real training gap around the science of reading and elementary school educators. We also have a real gap in access to reading specialists in high-need schools. And so we both aren't identifying kids early enough who have dyslexia, and we aren't necessarily providing as a country the kinds of instructional supports that students need. And I do think you have the problem at times that students then are misdiagnosed and prescribed medication when what they actually needed was good reading instruction in the first place. And so that is a real problem. There are some states that I think are working hard on improving screening for dyslexia and also improving training of teachers and administrators around dyslexia.
And I can share really quickly, we're one of the states that's actually just now completing a dyslexia project where we've tracked a number of identified classrooms and students and have been comparing the reading levels and reading attainment levels, both for fluency and understanding and decoding and the like, which will show, longitudinal, growth. So we're on the tail end of that study, and so we can support the efficacy of some of those programs. I'm going to be really honest. So there's two hats I wear. The first hat is, yes, that works. It's great. Maybe, I can't give you forecast what the study's going to show. But then I have to put on, my financial administrator hat and say, how are we going to pay for it? And many of those programs are extremely robust. They work, but we have to try to find the funding, which is why it's important to continue to invest in education.
Great. I think there's one question here and one in the middle then. Yep.
Is this on? There it goes. My name is Anna Burns, and I'm actually with the National School-Based Health Alliance. And within the last month, we've released a census study of all the school-based health centers across the country. So I just wanted to give a quick number that 6.3 million students currently have access to school-based health care nationwide. And one of the trends that we've been seeing over the last 5 or 6 years is the emergence of telehealth, particularly in rural areas and medically underserved areas. How do you all see telehealth kind of coupling with education in the coming years?
Yeah, I'll let my expert colleagues in education, but I'm very involved with the largest telemedicine company in the world. It's called Teladoc, and I see the advantage. Within 8 minutes, we can reach 3 million people every year at a very low cost, $40 to talk to a board-certified physician. I mention that, again, not to advertise Teladoc, but to show the reach we have the infrastructure, we have the know-how. Our federal legislation, effective January, has broken down the barriers. When I started, telemedicine, telehealth would not be reimbursed by states when I started. Now that it is, huge impact, technology, it's simple, it's inexpensive, and so I'll take it from there. But in terms of access, because we're not going to be able to put a nurse in every school. We need a nurse or a health personnel with that expertise when 25% of the population have some basic health need every day they come to class. Telemedicine to me, and again, why I'm optimistic in many ways, is a huge opportunity that barriers at the state level have been broken down in the last 2 years and at the federal level have been broken down. And telemedicine has been used in East Tennessee. The Niswonger Foundation has used not telemedicine, but teledelivery of health into schools with huge success. And again, it's one of those areas that now that the ecosystem has lowered the barriers, I think it can expand greatly. And both of you probably have experience with telehealth in your schools.
Yeah, I guess the thing I would say is that it is a way to address some needs, but obviously can't address all needs, and we need to have a greater sense of urgency around meeting the healthcare needs of rural kids. And I think not just about access to nurses and doctors, but access to dental care. So, you know, to go back to the point about Medicaid expansion, what we have seen is that in the states that have pursued Medicaid expansion, you have had a strengthening of rural health care and the survival of rural hospitals, whereas in states that have not expanded Medicaid, many of those hospitals are closing. So there is a real urgency around directing resources to addressing rural health needs.
And for us, our Department of Human Services and Department of Education have been convening superintendents, especially in our rural areas, to really inform what the practice can look like and does look like, not only for traditional telemedicine, but for mental health services as well. So in working with our superintendents and their teams, better understanding what their needs are, how they've been most successful, and how we've been able to utilize some type of hybrid model so we're not leaning too heavily in one area versus another. And you know, they've been informing both our policy recommendations, but also what some of the nuance and contract language. So our counties deliver much of that funding, and sometimes the way it's viewed as a line item budget as opposed to a mission-driven budget is one of the areas that we're trying to change right now.
Probably have time for one final question. Please.
My name is J.R. Denson. I'm with Inova Health Systems, and two folks, Senator Frist and Secretary King, mentioned data sharing. And I'm curious what, if anything, you're working on or would like to see happen in order to address issues with HIPAA. One of the P's in HIPAA stands for portability, and actually making it appropriately more portable for community-based organizations and other cross-cultural, cross-sector collaboration to be able to complete research and help in this particular area.
Well, I'll just say, in the Obama administration, one of the things we did was put out guidance, particularly for our Promised Neighborhood communities, where they were trying to connect across different sectors. We put out guidance for them explaining the rules more clearly and showing people the degree to which data sharing is possible under current law. Secretary Rivera made this point. People sometimes overinterpret the limitations in HIPAA and FERPA, and as a result, choose not to share data that could be shared to the benefit of kids and communities. Now, as an advocate, one of the things I worry about is how do we balance the desire for good information sharing by service providers with parents' legitimate concern with privacy, and helping to construct good rules that allow the right people to have access to the right information in a secure way. Because we do see in a lot of states a lot of parent concern, particularly when they turn on the TV and they see news reports about data breaches or about companies exploiting their data. They're rightly concerned, and what we see in some states is then legislators will propose bills that are overly broad and would make it harder for educators and healthcare providers to serve kids well. So as advocates, we're always trying to strike that right balance.
I have very little to add. I will say that the access to data, I think it was expressed perfectly, because it's a balancing act. The explosion in data, especially in the area of social services, non-medical aspects of health data, plus what you see is the health data is a challenge. In 1998, when we wrote HIPAA per se, it's still the standing law, but that was before any iPad, iPhone accumulation of data today, and it is one of the areas that we do have to come back to, not to dictate from Washington, but set some guide rails in terms of this explosion in data, which we know has huge power. And you, with the NOVA and the large systems, have more and have the money to access more healthcare and social determinant data than anybody. And so I think your question really is a challenge to all of us, and especially to those in Washington, of the people in this room and who are listening today, to come back and struggle with that balance that John looks at. I will say the parallel computing, supercomputing, more personalized healthcare, telemedicine, these technologies were not available 5 years ago. The data was not available 5 years ago. And again, starting with the Obama administration, who the chief technology officer basically said, this is a big deal. We have to be careful, but we need to begin to release this data in a de-identified way was a right first step. And I think it's incumbent upon all policymakers to take that next step so that people like you who are doing the systems data, the health data, getting involved in the community, looking at the community assessments, looking at schools, and getting involved can do it in an appropriate, ethical, moral, equity-sensitive way. I think it's a fantastic question.
I know there are a couple other questions, but given the time, maybe you can catch the speakers on their way out. But Senator, Secretary, any final parting words for the audience and those viewing today?
No, I think we got to take the best of organizations like Nashville Health that are in the health advocacy and the best of the education advocacy world and collide them together. And with that, good things are going to happen.
Great. Secretary?
Two things, one sobering and then one more positive. So the sobering note is, this didn't come up much in this conversation. We have to stop doing bad things. Folks saw the Washington Post article last couple days about school infrastructure. When teachers are cleaning rodent droppings off of the rug where they're teaching reading, that is bad for kids' education, it is bad for their health. When you have schools in Baltimore where the water fountains are covered over with plastic bags because of lead in the water, and so kids aren't drinking water during the day, that is bad for kids' education, it's bad for kids' health, and it also sends a message to kids about how much the society does or doesn't value them and their education. So in addition to all the good things we talked about today, we also have to stop doing some of the bad things we are doing by underinvesting in public education, including the infrastructure of our schools. On a more positive note, thank you for the opportunity to be here. It is inspiring to share a stage with Senator Frist and Secretary Rivera. And it's a sign of what is possible in a world of bipartisan collaboration and commitment to kids first. What Senator Frist has accomplished with Tennessee's score and the degree to which Tennessee as a state, across sectors, business, civil rights, higher education, political leaders are committed to educational improvement and have made so much progress over the last decade. It's truly inspiring. And Secretary Rivera thinks in collaboration first and working across agencies. And so makes me hopeful about the future of our country.
Great. Secretary Rivera?
First, I appreciate the opportunity to be here and share, but probably most importantly, to hear and to listen. I mean, there are lots of thoughts I do. Every time I looked over at my colleague, we're taking notes to steal all of your great ideas. So you may be reading about them, and I might not give you credit for it, so I apologize in advance. But I think, more importantly, the opportunity here for us to share and really realize an important fact that has been, brought up over and over again. There are many, many, many good people, good organizations, good community members doing amazing things for our communities and for our students. The issue is everyone's doing them in silos. And so at the end of the day, you have some very fortunate individuals who can utilize them as a super user, but there are many, many more individuals that aren't using or utilizing any of these services because they just either don't have access, they don't have the stamina to access many of these opportunities, or the system is just not set up to serve them in some of the most vulnerable communities. So as much as we can, work together to break the barrier so that we can work together to the same end, do what we do well, while serving our population in a real holistic way. That's how everyone, in our schools, everyone in our communities, each and every single one of our students will benefit and can continue to learn in an environment that they're deserving of. And so, being here today and being able to hear, but more importantly, being able to really hit home with the message that, we should continue to do what we do, but work together to maximize our impact on our most vulnerable communities.
Well, thanks for your leadership, and thanks for being here. Thanks to Rochelle and the Healthy Schools campaign. Thanks for all your leadership and effort. Thanks, everybody, for being here.